What should I consider to pick the right health insurance plan? Choosing the right health insurance plan can feel overwhelming, but understanding some key factors can make it much easier. First, think about your current health and what you might need in the future. Do you have ongoing health issues that requiring regular doctor visits or medications? Are you planning any major procedures or expecting a family addition? If you are generally healthy and rarely see a doctor, a plan with lower monthly premiums and higher out-of-pocket costs might suit you. But if you have chronic conditions or anticipate needing frequent care, look for a plan that offers more comprehensive coverage, even if the monthly cost is higher. Next, consider your budget carefully. Your monthly premium is just part of the picture. You should also understand your deductible, which is the amount you pay before insurance starts sharing costs. Then there are copayments, fixed amounts you pay for each visit or prescription, and coinsurance, which is your percentage of costs after meeting your deductible. Also, check the out-of-pocket maximum, the highest amount you will pay in a year. For example, in 2025, the maximum out-of-pocket limit set by the Affordable Care Act is $9,450 for individuals. When comparing plans, estimate your total yearly costs based on your expected healthcare use, not just the premium. Sometimes a plan with a lower premium may end up costing more if you need frequent care. Understanding the different types of plans is also important. Health maintenance organizations, or HMOs, usually have lower out-of-pocket costs but requiring you to use in-network providers and get referrals for specialists. Preferred provider organizations, or PPOs, give you more flexibility to see any doctor without referrals but tend to have higher costs for out-of-network care. If you're shopping on the Affordable Care Act marketplace, plans are categorized into metal levels, bronze, silver, gold, and platinum, that indicate how costs are shared. Bronze plans have lower premiums but higher deductibles, covering about 60% of costs, while platinum plans have higher premiums but cover about 90% of costs. If you qualify based on income, you might also consider a silver plan with cost-sharing reductions, which can lower your out-of-pocket costs significantly. Another key factor is provider access. Check whether your current doctors, specialists, and hospitals are in network for each plan you're considering. Being forced to switch providers can disrupt your ongoing care, especially if you have established relationships. If you travel frequently or live in multiple locations, verify that the plan offers nationwide coverage or has good out-of-network options. Prescription drug coverage is vital if you take medications regularly. Review each plan's formulary, which is the list of covered drugs, and see what your copays or coinsurance will be for your medications. Some plans cover certain drugs at lower costs, which can make a big difference in your overall healthcare expenses. Beyond basic coverage, look into what additional services each plan offers. Some plans provide better coverage for mental health, physical therapy, dental, vision, or fertility treatments. All plans on the marketplace must cover the 10 essential health benefits, including preventive services at no cost, but coverage for extras varies. When comparing plans, use online tools or speak with brokers to see side-by-side comparisons. Read reviews and provider ratings if available. Remember, the lowest premium isn't always the best choice. It's about finding the right balance of coverage, costs, and provider access that fits your health needs and budget. Finally, make your decision during the open enrollment period, which for the upcoming year runs from November 1st to January 15th. If you enroll early, your coverage can start at the beginning of the new year. If you have employer-sponsored insurance, review your options carefully during your company's open enrollment. Take your time to evaluate all these factors, because the right health insurance plan is the one that best matches your health needs, financial situation, and lifestyle. Always remember to consult healthcare professionals for personalized advice and to ensure your coverage aligns with your specific health circumstances.